Frank! Frank! Hurry! Mr. Bergeron's on. Don't forget the popcorn, Frank.
Coming, dear.
Okay. Hello. Hello. Thank you all for coming. My name is Arthur Bergeron. This is the next in a series of presentations that I've been doing here at the Southborough Senior Center in conjunction with the Council on Aging. I do elder law. That's all I do. I work at a firm called Myrick O'Connell. We have offices kind of up the street here in Westborough and also in Worcester. There are 56 of us, so other people do other things. Pretty much we can deal with any problem you've got, but if you've got an elder law problem, kind of that's me. And the purpose of today's presentation is to talk about dealing with Alzheimer's, because a lot of the clients that I have are people who are worried about getting Alzheimer's or another disease that's going to cause dementia, or if they've got it, now what do they do? And so we're really trying to do a series this year that is just kind of focused on those issues. One of my jobs actually as an elder lawyer is to certainly know the legal piece to that, but it's also to introduce you to the people that you need to know when you're facing these kinds of problems. And that's why today I brought Shelby Marshall with me from Right at Home. Right at Home is a wonderful home care agency also just down the street. They're located in Westborough. They do a lot of work here to talk to you about how home care would fit into all of this. And Eric Kressler from, I'm always doing that. Because I'm always thinking that it's from New Horizons, right? There is that's a bad thing when I'm getting, right? There is from the memory care unit at New Horizons called Hearthstone. Hearthstone actually is not just at New Horizons, but in a number of assisted living facilities. So we're going to talk about that. Because what we're trying to deal with today is not folks who have really got early stages of dementia where you're trying to figure out whether there's an issue. At this point, you know there's an issue. You know my friends Frank and Mary. We've talked about them before. They have 3 children, Peter, Paul, and Mary Jr. For today, we're only going to talk about Mary Jr. since she's the daughter who lives around here who may be helpful to Frank and Mary if they've got an issue. We've always talked about the fact their goal is to die and be buried in the backyard. And then after they've died, to leave whatever they have to Peter, Paul, and Mary Jr. So it's a pretty familiar kind of basic estate plan. But the issue now is that Mary has had Alzheimer's for a while. She's been living at home. Frank's been taking care of her. Now the Alzheimer's is getting really serious. And the question is, so what are her options? Well, I got into this kind of work really heavily after my mother died in a nursing home in 1991, and I watched all this play out with her at home, with my dad. They kind of remind me of Frank and Mary, and watching all of the tension that arose as she got more and more anxious and depressed, and he got more angry. How come you can't remember? What does it matter? And then finally she ended up in the nursing home. Now at that time, when you were in the later stages of dementia, there really was only one option, and that was the nursing home. And that's kind of changed now, and that's what we're going to talk about a little bit. Because right now, as far as Mary is concerned, there were really 3 possible options. One is the nursing home. One is staying at home, because there are so many more services available at home now, even when you have advanced dementia, and there are government programs to pay for that. And then there's assisted living. So we're going to talk about all 3, because I always talk to folks about the fact that everybody's goal is to stay at home. And that's great unless you've gotten to the point where home is no longer safe. And the question is, from Mary's perspective, is home safe anymore, right? And is home the place where she's going to be really able to live the best quality of life that she can live, given the fact that she now has dementia? So first we're going to talk about the nursing home option. And we're going to talk about Frank and Mary. Once again, Frank and Mary, they own their home. It's worth $300,000. Frank has an IRA worth $200,000. They have joint savings worth $300,000. So they have total assets of $800,000. They're not rich. They've been okay, though. There's no mortgage. They've got total income of $3,000 a month, right? He's getting $1,500 a month from Social Security and $750 from a pension, and Mary's getting half of his, or $750 a month from Social Security. So they've been okay. But the question is now, in this situation, what's going to happen? Now, typically when clients come in and talk to me about this situation, they're convinced that, first of all, maybe that the only option is a nursing home. But also they're convinced that they're going to get killed as a result of the fact that they haven't done any advanced planning regarding their assets. So the first thing, the big take home, which if you've been here before, you've heard before, is that in this situation, Frank and Mary will not have to spend down any of their money on a nursing home if Mary needs nursing home care. Now, in order to understand that, by the way, and to understand some of the other things that we're talking about, I just want to introduce one other term, the activities of daily living, the ADLs. And you say to yourself, well, what's an ADL? Activity of daily living, that's everything I do in a day, right? Well, yes, but there are some specific ones that for purposes of these kinds of programs you want to know about. These activities of daily living, dressing, eating, bathing, toileting, and transferring. Transferring means getting up out of your chair, walking across the room, sitting down. If you need regular assistance, physical assistance with at least 2 of these, then for mass health purposes, you are qualified to be in a nursing home and to receive mass health assistance in that nursing home. You're also qualified for some other things, and we're going to talk about those as we go along, but kind of remember that. But in terms of if Mary needed to go to the nursing home right now, if she needed assistance with at least 2 of those activities of daily living, or if she needed constant supervision, because otherwise it wouldn't be safe for her because she was going to wander, then she is eligible, if she's in a nursing home, to have mass health as long as she's financially eligible. Now, for Mary to be financially eligible, she has to have less than $2,000 in countable assets. Frank, though, can own the home as long as the home has equity in it of less than $814,000. He can have cash or cash equivalent assets, that is, things like he's got, his IRA, his savings account, etc., of up to $117,240. And in addition to that, he can have infinite income. He can have infinite income. So in this situation, if Mary needed nursing home care, there really wasn't another option, they didn't feel safe anyplace else, then we would shift all assets to Frank. Frank would then take the money that is over $117,240 and he would buy an annuity with it. What is an annuity? An annuity is a contract between somebody and typically an insurance company. You give them money. In return for that, they agree to give you payments, monthly payments over a term. As long as Frank is buying an annuity for a term, and as long as the term is shorter than Frank's actuarial life expectancy, and to give you an example of that, if Frank were about 80 years old right now, his actuarial life expectancy would be about 8 years. And so as long as that purchase was for shorter than his life expectancy, then the purchase of that annuity, taking all that extra money, the money that was over $117,240 and buying that annuity, is a legitimate conversion from an asset, the money which put him over, to an income stream. And remember, Frank can have infinite income. So in this situation, if Mary needs to go to a nursing home, and that's the only option, Frank can qualify her for mass health right away. The only other thing that Frank would then want to do, though, is he may want to change his will and change his will, because now he owns all the assets. Chances are what his will says, and remember I mentioned at the beginning, their goal was, well, if one dies, everything was going to go to the other, and then after the 2 of them, they were going to divide things among the kids. If that's what his will says, and Frank now dies, and Mary needs nursing home care or is in the nursing home, Mary's going to inherit everything. Oh, which means Mary's going to have way more than $2,000 in countable assets. So all those funds she inherited are all going to have to get spent down on the nursing home care. Then she'll qualify, even though she still has the house, but Mass Health will then put a lien on the house to make sure that it gets repaid after she dies. Now, Frank and Mary can avoid all of that, even at the last minute. There's no look-back periods on any of this. Frank can avoid all of that once the assets have been shifted to him by simply changing his will to say that following his death, instead of everything going to Mary individually, it's going to go in trust for Mary's benefit. He could name Mary Jr. as the trustee of that trust. If he did that and then died, all the funds that he owned and the house would be protected. Mary would be the trustee. Mary could use that money and the house, actually, to provide for supplementary care for her mother. But none of those assets would have to be used to spent down on nursing home care. So if she has to go to the nursing home, that's their least favorite alternative, but it's possible and they're not going to get wiped out. The other things Frank would want to be aware of once she's in the nursing home is he'd want to visit her a lot and at different times of the day. It has been our experience across all nursing homes that the people who get the best care are the people who get the most visits, especially when the visit comes at different times of day, so that the people in the nursing home staff never know when you're going to show up. The other thing he's going to want to do is contact the Alzheimer's Association, because we've talked about the Alzheimer's Association here before. It's a national nonprofit. They give a ton of services for free. They have a 24-hour hotline. They give a lot of support services. They run support groups. He'd want to get involved with the Alzheimer's Association because they can help him go through all of this. So that's number one. What if she goes to the nursing home? Number two, what if she goes home? And by the way, we usually, when we're talking about earlier stages of dementia, we really talk about how you can spot dementia. That's not directly relevant in this case. So what happens if Mary, though, wants to stay home? Well, in that case, the first thing she wants to do, and she's probably already contacted them before, is she wants to contact Bay Path Elder Services. Now, Bay Path Elder Services is the regional entity that covers this area. Each community in the state is covered by one of these agencies. They're called Aging Services Access Points, or ASAPs. Bay Path covers this whole area. It covers 14 towns. Within those towns, if Mary needed nursing home care, Mass Health would need to get a certification from Bay Path that she was medically eligible if she was going to qualify for Mass Health. In addition, if Mary is eligible for nursing home care but wants to stay home, then Bay Path also can certify that and say, you know, Mary needs nursing home care unless she gets a given amount of services at home, right? And the kinds of services that she can get, whatever she needs, whether it is home care or day programs or a whole variety of services, once she is otherwise eligible for Mass Health, for nursing home care, then through the Frail Elder Waiver, she can get Mass Health to pay for that. Whatever services Bay Path Elder Services says Mary needs to be at home, Mass Health will pay for, as long as as long as Mary is otherwise financially eligible. Now, the eligibility in this case, same rule as you heard about for nursing homes. She has to have less than $2,000 in countable assets. But as far as Frank is concerned, in that case, Frank can have unlimited assets. So the plan in that case would be very simple, and we have this all the time. We just shift everything to Frank.
With Frank and Mary, Eldorado, with Frank and Mary, yeah.
Frank, hurry. Mr. Bergeron's on. Don't forget the popcorn, Frank.
Coming, dear.
And the next day, as long as Mary's income is low enough, she can immediately qualify for Mass Health. Whatever number of hours Bay Path says she needs to stay at home, Mass Health will pay for them. So there's a clear alternative for Mary. Now, the real question, therefore, that Frank and Mary would be wanting to ask themselves, well, they'd want to ask a couple. First of all, remember that, you saw their asset situation, right? So the question is, on their income, staying at home, assuming they get help from Mass Health, can they afford to have Mary stay at home? And they're going to need to figure that out. Because it may be that Bay Path says, well, Bay Path has the legal right to assign as many hours to Mary in home care as they want. But they typically don't, Typically, they won't assign more than 40 or 50 hours a week. Now, that's a lot of care, but it means there's a lot of remaining hours. So it may be that Frank and Mary will want to use some of their other assets in order to supplement that care. But in their case, they can do that. They've got quite a bit of extra cash. Remember, they have the IRA and they have some savings. They have about $500,000 in extra cash, right? But the question is this going to work for them? Is a home care agency, strangers coming to their house a lot, going to work? And that's why I wanted you to hear from Shelby Marshall, and you're going to hear from her a little bit later on about how home care works, what these agencies provide, because Shelby's agency is probably the agency that you would want to hire to do all of those extra hours that Mass Health isn't covering. So we're going to hear from her a little bit more. But the bottom line is that Frank and Mary could afford this. They could afford this with these kinds of assets for the reasons that we talked about, because you could simply shift everything to Frank, and then Mary could immediately qualify for Mass Health. So you'd shift everything, but once again, in that case, what Frank would want to do is change his will to make sure that if he died, the assets would still be safe, whether Mary wanted to stay home or whether she wanted to go to a nursing home. So over time, in addition to this option developing to allow you to stay at home because of all the home care you can get, there's another option that's developed: assisted living communities. These are communities that 20 years ago, when my mother was going through this, were typically meant for people who were just like slowing down a little bit, right? Like, you know, you had your house, but you're really tired of mowing the lawn, and you're a little worried about, you know, you don't want to shovel the snow, right? And maybe you really, really don't want to cook 3 meals a day, right? Or do some other stuff. Or you're just physically slowing down. You don't want to have to do that stuff. And so assisted living was really designed for folks who were still mentally fine, or maybe slipping a little bit and losing a little memory, but basically just wanted to have some assistance in taking care of things. But then over the last 20 years, there have evolved these wonderful memory care units in a number of assisted living facilities. And one of them is Hearthstone. Hearthstone I got introduced to because I live next door in Marlboro, and New Horizons, which is a very large assisted living facility in Marlboro, after they were set up and created, started contracting with Hearthstone to run or to have a memory care unit right there. These are memory care units are so-called social model communities, so they are not nursing homes. They are not nursing homes, and therefore you can't pay for them using Mass Health. There are some options for paying for them, though. I'm going to talk about them a little bit later after Eric is done. But I think many people just dismiss these out of hand. So remember these two things, VA and tax deductibility. We're going to talk about both of those after Eric kind of talks about what a memory care unit is. But I wanted you to get a sense of what they are, how they work, and why, in a certain situation for Frank and Mary, they may be the right answer. Eric.
Thank you, Arthur. My biggest challenge is to remember how to work the clicker. I'll put that down for a second. Thank you for having me here. I appreciate it. If I ask the question, how many people here know somebody that's caring for somebody with a memory issue, dementia, or Alzheimer's, or is themselves caring for somebody, I might get, how many people know somebody that's either caring for somebody that has a memory issue, a loved one, or themselves caring for somebody? I might get most of the people in the room would know somebody that might have Alzheimer's, dementia, or a memory issue, or most people, may be caring for somebody themselves. So if I ask the question, what do you notice about your friends or your family members that are caring for a loved one with dementia, Alzheimer's? What do you notice happening to that person caring for their loved one? You're pointing thumbs down. Tell me some more. Thumbs down, what do you notice happening?
First of all, they're housebound 24/7.
The person, the caregiver, is housebound.
Yes. Second of all, it's going into territory that they've never been before. Like maybe cooking, cleaning, taking care of all the pills, assisting driving, and stuff like that. The social thing is completely cut out. Then the family thing starts to cut out because of the negativity and the issues. And then it becomes, it's a great issue. Nothing works.
Yeah, that's a lot. So loved ones can get, as the process continues, become isolated themselves. They're doing things, as you're saying, whether with medication, that who in their life ever thought they'd have to be doing. So, and here's what we know, that's wonderful. So you'd probably want to see, if you were a fly on the wall, you'd want to see that your loved one was being cared for, doing things that had meaning to that person, doing things that, that your loved one was engaged. So I want to talk, when Dr. Zeisel, Heartstone was created by Dr. Zeisel, and there were only 6 residents for Heartstone, 6 assisted living residents. The goal was to be a thought leader in the care for people with dementia, memory issues, Alzheimer's. So we talk about I'm still here, and that's what our approach is. We talk about that I'm still here. And the thinking behind this is to create an environment. One of the things we know about dementias, memory issues, dementias, and Alzheimer's is that we don't have a drug at this point in time to cure. But we do know the more engagement around meaningful and purposeful activities, conversations, that the process slows. So the thinking behind is Dr. Zeisel, in our research, talked about we want to create an environment, and he talks about we talk about the 4 A's, the anxiety, aggression, apathy, and agitation. And the thinking is, if we create an environment where people are engaged in things that are meaningful and purposeful, that those symptoms of memory issues and Alzheimer's will go down drastically. And that's what we do. So research shows the most successful treatment for dementia is a coordinated approach. Heartstone Care Model, we use both pharmacological and non-pharmacological approaches in combination. We do not go at Heartstones to medication first. We first employ the non-pharmacological to reduce symptoms. Second is then appropriate use of medications. An example, Norman was a gentleman who was living at home with his wife. Norman came to us after years with his wife, incredibly committed, and it just couldn't work anymore. Norman would get very anxious at definitely afternoon, sundowning time. Where's my family? What's going on? Things like that. What we did instead of medication, and we are not, people are, will have medication at Heartstone, but what we did was create a visitor's binder. So when people came, we took pictures, and then they wrote stories of the visit. So whether it be his sons, whether it be his wife, or whether it be, yesterday he had family over, brothers over, and had a wonderful time. Picture, and then we had a great time. This is what we did, this is what we talked about. So for Norman, he was there to open that up and we could read that with him. So that's an example of a non-pharmacological approach. So we talked about the 4 major categories. Symptoms are apathy, aggression, combativeness, behaviors, agitation, and anxiety. The 4 A's, we call them. So our mission is to present a positive and hopeful message. And what we know, the brain has about 100 billion neurons. When the brain of somebody with Alzheimer's dies, there's 60 billion. Our focus is on the 60 billion. One of the things we know about the brain is the part of the brain that's not impacted by the dementia is the emotional part and the procedural learning part. People can learn. Procedural learning, we know how to tie our shoes over and over and over again. We do it like it is hardwired into our brain. So we talk about at Hearthstone, our programs are designed to offer our residents experiences instead of activities. We want experiences. Anything that we can do, we might be able to do it quicker, but we want our residents doing it with us. Whether I'm asking Jim, would you mind helping me? I had to take some boxes out, and in the time we're talking about it, we're talking about how he used to have to clean up. It went from, would you mind helping me unload some of these boxes, to raking the yard in the fall. Do you mind doing this type of stuff? No, mine's me a raking. Did you have a big yard? So we got off in this conversation as we're doing it together, meaningful and purposeful. So we talk about engagement, 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 engagement. The beauty of what I hear every day, I'm the executive director. I hear every day, would you mind helping me? How, it's great to see you. You know, always about engaging. What's one of the most important things? We wake up in the morning and somebody's looking forward to seeing us, whether we're grumpy or not. That is what we create an environment. We have our activity program features specialized from our research. Hearthstone we have our own research division, where not about medical issues, about how people with dementia can learn. I'll share a couple of things very briefly with you. So we have what we call Hearthside readers. We have hundreds of topics, from the ancient mysteries to movies of the 1950s to the Beatles, the Fabulous Four. So we have them for early stage, middle, and late stages. So if you can picture me saying to you, would you mind helping me, or would you mind helping me with our book club? And then we'd come over a small group. We'd let the residents would pick out a topic, and we would read. Now, if you start to see, the print is bigger. We know that from our research. But here's the beauty. So we talked about the Beatles have tried many types of music before settling on rock and roll. Do you have a favorite type of music? Rock and roll, country? Conversation, conversation, conversation.
With Frank and Mary, Eldorado, with Frank and Mary, yeah.
Frank, hurry, Mr. Bergeron's on. Don't forget the popcorn, Frank.
Coming, dear.
The goal is not to get through. So if you were a fly on the wall in a Hearthstone residence, you would see residents getting invited down for breakfast. You would see residents having a morning meeting where the residents run, talking about the news, about the weather. Staff helps facilitate. If it's later stages of Alzheimer's, we would have music in motion. Everything is about engagement that we do. We have a program, Meet Me at the Movies. 6 to 7 minute clips. I Love Lucy, Casablanca, The Wizard of Oz, with conversation at the end. So what do we know? Engagement, 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 engagement. So as you said, Hearthstone is the center. We have our research department. We have our institute. We have organizations from around the country, around the world, come to us to learn how we do things non-pharmacological approach. And we're having a group from California come in next week. So thank you for the time.
So I guess I asked Eric to come over because Hearthstone, first of all, it's a great facility, but it's also close to here. But there are a number of these. There are a number of memory care units in assisted livings that are evolving now. And what's great about them is that you have a set of trained staff, like the people who are working with Eric, who are understanding the best way in which to be dealing with folks who have got serious dementia. Because I think that's one of the hardest things. I mean, one of the things that I've come to appreciate versus when I watched this happen with my mother. And I had always thought that there were a set of symptoms that are Alzheimer's symptoms and that they're all the same. And one of them obviously is just lack of memory. And then in more serious cases, it's lack of memory about very simple stuff, so that people really just can't follow basic instructions, may not remember how to brush their teeth, may not remember how to take a shower. So the memory loss gets worse. And then there were these other things. There was the aggression, there was the apathy, there was the anger. And I had always assumed that those are those are symptoms of Alzheimer's. I have come to believe those are secondary symptoms. Those are things that result from the person reacting to the other symptoms, to the fact that they can't remember stuff, or the fact that people are constantly asking them things and they can't answer the question, right? Well, so the question really for those folks is, you're not going to get the memory back, but how do you get rid of those things, the anger, the anxiety, the depression, so that people who don't have memory are still having a meaningful day? They're still having a meaningful day. Because the goal of life is not to be able to do the New York Times crossword puzzle. The goal is to be able to have a good day, to feel that you're doing something useful, that somebody cares about you, and that you're just living a meaningful life. So I also mentioned, though, I wanted to talk for a few minutes about, before we go to home care, I'm just going to go back for a second. I'm going to go all the way back to that money slide there. So one of the big questions, though, and that people constantly talk to me about, is they say, well, I can't afford it. I just can't afford assisted living, right? Because it's not a nursing home, and therefore Mass Health is not going to pay for it, right? And we just don't have the money. And because obviously, from both Frank and Mary's perspective, one of their goals is to not run out of money before they die, right? Neither of them can afford to run out of money before they die, so they want to make sure they're okay. But remember what their situation is. Remember what their financial situation is. They've got a house that's worth about $300,000. They've got other assets that are worth about $500,000. So I'm just going to mention two things. One, if Mary needs assistance with at least two of the activities of daily living, and in this situation, she does. If she's at the point where she's going to the memory care unit, either she probably needs that kind of assistance with her day-to-day life. Then, first of all, if Frank was a veteran, or if she was, but more likely at that time if Frank was the veteran, if Frank was a veteran and served during at least 1 day of war, one day of a period of war, right? And don't assume that you know what those dates are. For example, for the purposes of this benefit, World War II did not end about at the time of Hiroshima and Nagasaki. It ended a year and a half later, December 31st of 1946, right? So don't assume you know those dates. If Frank was a veteran, then Mary can qualify for a significant the aid and attendance benefit if she needs assistance with two of the activities of daily living, and if the payment to this memory care unit is a so-called bundle payment, if you're writing one big check to the company for everything that is being done for you. In Mary's case, that benefit would be about $1,000 a month. If Frank were the person that had dementia, that check would be about $2,000 a month. So assume that one of these memory care units is going to be costing you, if they're both, say that they're both, and many times there's a couple, right? That they're both in the assisted living, right? Assume that your total cost all in for a month is going to be about $7,000. Assume. Now, Frank and Mary's income is only $3,000, which means they're short by $4,000 a month, right? And that's a lot of money. And they've got some savings. They've got $500,000 in savings, right? So they can afford $4,000 a month for a while, but not forever. They can afford that amount of money for about 10 years. About 10 years, right? Now that's a lot, but that's not forever. But if Frank is getting $2,000 a month from the VA, or if Mary is getting $1,000 a month, now suddenly that amount that they're going to be having to spend, that extra amount that they're going to have to burn from their savings has gone down by that amount. It probably extends the amount of time they could stay in assisted living by another 2 years, actually, right? A second possibility, if Frank and Mary decide, if Mary needs assistance with two of the activities of daily living, And once again, if the check that is being, and I should have told everybody, including myself, to shut off their phone before I started. And if they're paying a so-called bundled payment, one big payment that's going to the assisted living facility, then that payment is a medical deduction. The entire amount of that payment is a medical deduction, right? Now, why would they care? Why would Frank and Mary care about that? Their income isn't that high. They're probably not paying any taxes. Well, remember I told you, though, they have 3 kids, Peter, Paul, and Mary Jr. And now what I didn't tell you is that in my usual example, Peter is doing okay. He lives in New York City. He's a lawyer. He's making a lot of money. Paul is living on the West Coast. He's a computer programmer. He's doing okay. In my typical example, Peter is, because he's in New York City, is in a high tax bracket. If Peter is in a 40% tax bracket, and Frank and Mary have decided to give their money to Peter, right? Now, obviously, you have to trust Peter in this case, right? That he's not just going to take the money and say, geez, thanks, Mom and Dad. But if Peter then pays that assisted living bill, and that assisted living bill is $7,000 a month or $84,000 a year, that could very well be a medical deduction for him. And he's going to get 40% of that amount, or about $30,000, $35,000, is the amount that his taxes are going to go down. Now, if he takes that money and keeps that money in a pool for his parents, for Frank and Mary, what he has effectively done is he's taken that $500,000 that his parents have and expanded that pot by about 40%. Expanded it to about almost $800,000, which means effectively that Frank and Mary in that situation could stay in assisted living probably for 15 to 20 years. Now, if you assume that they're 80 years old, that probably works out okay. That probably works out okay for them. So I guess the moral of the story, as far as assisted living is concerned, is don't, I'm just going to run back so that I'm caught up. Just going to take a second. Is don't assume that assisted living is too expensive. Start off by go see Hearthstone or go see an assisted living facility. And once again, this is especially for many of the folks who are here. You are here because you've been engaged in some of this stuff and you know a lot of this stuff. But for the people who are watching this on cable at home, that's what's important, is that they understand this possibility. Go see these places, see if they would work, see if they would provide a safe place for your loved one who has Alzheimer's, a safe place and in a place where they're going to feel like they're going to live a meaningful life. Then go to a professional and see if you can make the numbers work. Now, similarly with home care. Remember we talked about the fact that if Mary needs nursing home care, she's also qualified for the frail elder waiver. She can get a lot of benefits. She can have Mass Health pay for a lot of hours while she's at home. The question is, though, oh my God, is that a good idea? Is that a good idea? Having people come into my home, what's that going to be like? So I wanted Shelby to really talk about that, talk about how that could work, who these people are who are coming from agencies. And I guess my message, my bottom line message is, remember when you're hiring somebody to come in to help you to deal with your loved one who has Alzheimer's, that's not the same as they're going to just wash the dishes. You need someone who is going to understand how to deal with your loved one who has Alzheimer's. Shelby.
So I represent an agency based in Westboro. We service many, many towns. I'm really here to talk about home care, not specifically our agency. Some of the flavors of which I'll talk about are specific to our agency, but not unlike Eric's presentation. The intention is really to talk about assisted living in a broad spectrum. I think not unlike researching assisted living, you have to research your home care options. It's your money. It's your loved one. You want to make sure they're receiving the best care. It's important to do your homework. So that's sort of my baseline. So that's our office. That's my business partner as well. So let's talk about home care. Okay, so home care may be appropriate for your loved one, a friend, whomever, whether they're at their early stage of dementia, Alzheimer's, or whether they're late stage. There are many considerations you have to think about with home care, and I'd like to touch on one of the lead ones that Arthur spoke to. My God, I'm going to bring a stranger into my home. So we will talk about that in depth. The reality of it is that when you're moving into an assisted living, Strangers are caring for you. The difference is they're not in your home. So you do need to have a comfort level that strangers will be coming into your home, but that's part of how you vet or research agencies to understand who are these people and what sort of background checks do they do, and we'll talk about that in a minute.
Eldorado with Frank and Mary. Eldorado with Frank and Mary. Yeah.
Frank, hurry, Mr. Bergeron's on. Don't forget the popcorn, Frank.
Coming, dear.
But the benefits of home care is that home care is one-to-one. So you have a caregiver who has specialized training. You want to make sure that you're working with an agency that does train their caregivers, or that their caregivers certainly have that baseline training. And that care is one-to-one. So I'm your caregiver, and we work one-on-one for however long I'm there. I might be there for a couple hours, or I might be living in the home 24 hours and providing care during that time. Typically, there's a team of caregivers if the care is for a long period of time, so it wouldn't be just one person, because those individuals, not unlike the caregivers, you gave some great examples for your mom as well, caregivers get tired. Our caregivers get tired. So we want a team of folks that are familiar with your loved one's care to care for them. The goal is really independence, safety, and managing, signs of aggression, anxiety, et cetera, et cetera. So the goals in home care are very much the same as if you were living in a facility or a residence, but the care is one-to-one. And the idea is to keep that individual as independent as possible. So the idea is not to say, let me tie your shoes, but it is to help that person to make sure when they're tying their shoes, they're not tipping over and falling on their head, loss of balance or what have you. So a simple example. Care is provided when you need it. So home care is very, very flexible. So it's provided for a couple hours at a time. Maybe it's sort of a wake up and a tuck in, we sort of call it. So if someone coming in around 7 in the morning till 10, get someone up, help them with their medications, showered, meal, ready for the day, maybe prepare lunch, and then coming in the evening to do the same sort of in the reverse order, okay? We also provide care that's overnight, certainly weekends, 24/7. And again, every agency is different. Sometimes there are minimums in terms of how many hours an agency will provide care. Sometimes it's no fewer than 3. Some will do 1 at a time. Some do live-ins. So again, that's all part of your research. An important message here, care is not only for the client. It is so important that families, whether it's a spouse or their adult children, embrace it, that the care in some ways is very much for them as well. It's to give them respite. And so I'll give you a very specific example. I actually was engaged with a conversation yesterday with a woman whose husband is 62 years old. He has a brain tumor, and it is resulting in dementia-like symptoms, if you will. She is trapped. She is absolutely trapped in that she can't. She has a job where he can actually, she volunteers, so he can actually kind of go and sit, but she cannot leave him alone. No children, really no extended family. She's like, what do I do? So here's a woman who can't even go and get her hair cut without, and she loves her husband, it's not about not loving him, but she cannot just go to the grocery store. He has to be with her because he's scared and she's scared he's going to fall, et cetera, et cetera. So in that instance, a home care agency could come in for a couple hours, 1 time a week, and just give her a break. So it doesn't have to be sort of this, I'm going to launch into constantly having an agency sort of in our home. It might be intermittent. And in that case, it would be respite for her. So just an example. So this is a little bit of an eye chart, but you do have this in the presentation. So home care agencies provide a variety of services, and not unlike assisted living, they're based and tailored around what the individual needs. So they might be very basic, like helping to do the laundry, change the bed linens, helping with housekeeping. And then they get more progressive based on the individual's needs. So the ADLs, or activities of daily living that Arthur mentioned, we help with those all the time. Bathing, grooming, dressing, transferring, toileting, helping with medication reminders, etc. So all agencies are not sort of, if you will, created equal. Some will do medication assistance, others won't. We happen to have nurses on staff, so we can actually not only help with medication reminders, which anyone can do, but we can actually help fill the pill boxes, interact with the physician, go get the prescription, et cetera, et cetera. So it's, again, each entity is a little different. The other thing that we do is some really cool stuff. Like, we had a family where mom had Alzheimer's, actually it was a grandmother, I should say, and the granddaughter was getting married. So the grandfather is still alive. He wants to go to the wedding. They want mom to be there, but practically speaking, because of mom's progression of the disease and both her personal care needs, she wearing Depends, she could not go to she would need some assistance. The family's like, how do we do this? We don't want to just leave mom at home. We want her to be part of this. So they hired us. We sent an aide. And that aide dressed as if they were a guest of the wedding. We introduced that aide as a friend of the family, and that aide was with grandma during that event. So grandma was in the pictures. I get goosebumps still when I talk about it. She was part of that event, and the family could enjoy that event for what it was and still have her there, but not have to worry about it and not to be her direct caregiver for that day. So that sort of specialty, unique, it can be one-off type of care, is also a benefit of home care. We also provide help with hospice support, which we're not here to talk about that, but that sort of becomes sort of the natural progression, right, of Alzheimer's dementia. So hospice is a benefit through Medicare or Medicaid and your health insurance, but it's sometimes those home care services are provided as a wraparound. So here's the fun question, right? We're here to talk about Alzheimer's. Can you afford it? So can you afford home care? Well, the good news is there are payment sources, right? So the Mass Home Care Program that Arthur talked about through BayPath, agencies like ours are contracted with ASAPs across the state, BayPath being the example for the Southborough area. And so the nice part is that you can receive a benefit through BayPath based on your income and eligibility and your diagnosis. And then you can also work with that same agency for private care. So let's say BayPath said you're eligible for 10 hours a week of care. Great. So that's going to be paid for because of whatever your income status is. Or it could be 40 hours. Again, it varies. And then you say, but I need help during the evening, or I need more care. Great. Well, you can work with the same agency because they're contracted with BayPath. You already have a relationship, and then you pay them privately. So there's sort of a sharing, if you will, of cost. Long-term care insurance pays for the type of services that we provide. So typically long-term care requires the individual or the family to pay up front, and then the agency works with you to submit the necessary paperwork, and then the family gets reimbursed on the back end. Sometimes the long-term care insurance policy will actually pay the provider directly. You've seen one policy, you've seen one policy. Arthur spoke about veterans aid and attendance relative to assisted living. That benefit for care is also true of home care. You have to qualify, it's the same qualifying criteria, but those dollars can also be spent to pay for home care. So that's another benefit or asset that could be used. And then your personal funds and asset. So the bad news is that Medicare doesn't pay for what we do. Medicaid doesn't pay for what private agencies provide. Whoops, there we go, sorry. Some health plans like United Healthcare and Fallon are starting to pay for kind of what we call non-medical home care. So remember, we're not the VNA. We're not the home health agency that's going to be there to provide physician-directed physical therapy, occupational therapy, work with you on diabetes management specifically. This is considered non-medical, so unfortunately, sort of the benefit really is sort of out of pocket. So, I mentioned in the beginning we would talk for just a moment about finding an agency. It is really critical that you do your homework. You want to ask questions. You are the consumer, it's your hard-earned dollar. You want to make sure that someone coming into your home is someone you can trust, an agency you can work with. Because remember, you're not just hiring that caregiver, that lady or gentleman, if it would be a caregiver coming into your home, you're hiring the agency. You're hiring the agency to be your team to help make sure that the caregiver is vetted, meaning did they do a background check? What kind of training do they have? In our case, we not only do we do queries or criminal background checks, we make sure they have a valid driver's license, right? Because in case that individual, they have an insured car. We actually verify that their documentation is accurate up through the Department of Homeland Security. Are they legal to work in the United States? Because you don't want something coming back around to you as the payer of those services that could affect you in a negative way. We pay for their we have workers' compensation. We cover their liability and we pay their payroll taxes. So you want to kind of understand the difference between an agency and maybe hiring another entity that doesn't do these things. Training is really critical. We're talking about Alzheimer's here. So you don't want someone, I mean, I have, oh, whoops, sorry, on the microphone. Have I worked with Alzheimer's patients and clients? Absolutely. Have I had family members? Yes, but I am not a trained caregiver. So I might be a nice person, but I'm probably not the right match for your husband, your wife, what have you, to be with that person 24/7 because I have not been trained. When you're working with a home care agency, you want to understand what's the training. Tell me about this particular individual, et cetera, et cetera. So it's just, the training is really, really important. Caregiver supervision. We do regular, I always mess this up, we do regular supervisory visits that are unannounced, meaning one of our nurses, a member of our team, will go to your house where you have scheduled care and make sure that the caregiver's there, that the caregiver has their badge on, that they're appropriately dressed, that the activities that they're doing are appropriate, that your loved one is safe, etc. So that's a critical part of when I talked about you're not just hiring that agency, that caregiver, you're hiring the agency to oversee that care. And then we provide that feedback back to the family. So the adult daughter who's living out of town and her parents are, in Albany, New York, or what have you. So we'll say, email these days or phone call. Here's what happened. We were provided a visit today, and this is what we observed. So it's not the photo book, although that's a fantastic idea. I love that. But it is sort of, real-time, same-day feedback to the family who's saying, I'm paying for this service. Like, is it worth it? Is it making a difference? Okay, so I'll just end on this note and certainly allow time for questions under Arthur's direction, but I would just reiterate that a lot of times folks that we initially get calls from are like, well, I don't know if we really need home care, and we're considering all of our options. Great, you should always consider all of your options. But I think folks sometimes forget that the care is not just for the individual, but it is so important that you as the caregiver have respite and have time and space to sort of still be yourself, to have social activities and to engage, because the gentleman that spoke at the beginning and provided some examples here, he hit it on the head. You become isolated, it's exhausting, and you shouldn't be ashamed or embarrassed or feel like it's a failure to ask for help. So I do appreciate your time, and if you have any questions, Arthur will take those.
Shelby, thank you very much.
Thank you.
So that gives you a sense, I think, of what the possible services are. So kind of to summarize, you really do have three possibilities if you're Frank and Mary. The nursing home is still one of them, and Mass Health will pay for that, and the assets are going to be safe. But home care is also one of them, if you think that can work. And it may very well be that assisted living in a memory care unit is also one of them. And contrary to what many people would expect, it's probably an affordable alternative. So what you really want to look at is you want to look at all of them. The goal of all my presentations is peace of mind. The goal of this exercise is so you can sleep well at night. So I hope that this was helpful. If you've got any questions, we'd be glad to take them afterwards. All these folks have agreed to stay for a few minutes. Could I ask for a quick round of applause for my wonderful guests who are willing to come today? Thank you very much, and we'll see you next time. Thank you all.